We're living longer lives, but with more years in poor health than at any point in history. How can we change this? And what are the pharma industry's responsibilities and opportunities? These questions and many more will we, MSD, try to answer together with people of different perspectives by creating a space for dialogue. We hope to promote diversity of opinions and provide food for thoughts. We call it Voices of Pharma.
Welcome to Voices of Pharma. My name is Petter Strifeldt. I'm with MSD, and today I have with me Kristine. Kristine?
Yeah. My name is Kristine Sørensen. I'm based here in Denmark. I'm a global expert on health literacy.
Excellent. And today we're going to talk about, namely, that health literacy.
Health literacy is about people's knowledge, motivation and competencies to find, understand, appraise and use information to take decisions in everyday life on health and to navigate health systems. It has two sides to it. One is the personal competences for people to deal with information and take informed decisions and share decisions, but it's also the relation with the healthcare services, healthcare professionals. So we don't do that in isolation. We're part of a larger system, and therefore also the way we have designed our systems influence our health literacy.
Health literacy is sort of a bucket phrase, you know. It entails so many things. Is it possible for us to sort of define, well, this is health literacy, but under this we have this type and this type and this type of literacy? Or how do you, as you know, you have been looking into this, how do we define that as well?
Health literacy can, on one hand, be considered a very broad term. It's like a kitchen sink. We put everything into it. Or very narrowly, it's the outcome of health education, formal and informal education. But it's also influencing the way we think about health, our health beliefs. It's influenced by our personal factors, situational factors, where we live, love, play, work, and the cultural factors. And it's content and context related. So content means that it's linked to, for example, diseases, diabetes, cancer. When we get a new disease, we need to know about it, like COVID-19. But it's also context related. So it's influenced, for example, with school health, hospital, patient health literacy, vaccine health literacy. And then it becomes quite simple, because then it's really about what kind of information can you find about it? Do you understand the information you receive or identify? Can you judge if it's relevant for you? Can you actually apply it? So it becomes the ability to act on your health, not only to know, but really to know how to act.
Maybe the future lies within, you know, strengthening the health literacy part.
We see a growth in digital health, both among private stakeholders, the government, especially in the Nordic countries. They're highly digitalized. But that also puts a demand on citizens to be able to navigate the digital world. And we see, I wouldn't see a gap, but there is a spectrum of where people are on that digital skills or digital literacy spectrum. So link that to the healthcare context and health literacy.
What role do you think MSD should have in a rather complex network and in a rather complex system that you are describing related to health literacy? What role should MSD have?
I see that the pharmaceutical industry has a strong obligation to help people understand medical information. It's what you do. Pharma produce products, but there's a strong obligation also to make sure that people know what they're taking, what kind of medicine they're taking, and how to take it. We often get the feedback from pharmaceutical actors that, yes, due to legal restrictions, it has to look like that. But there are also now ways how to go around it, so that we can make lay summaries of some of the information. We can redesign labels. We can use color codes. So the whole idea of information design, graphic design, pictograms, and so on. There's a whole new world opening there, and I'm very sure that integrating that kind of tools into the way we produce information, produce products, interact with professionals, how you train professionals, pharmacists, medical staff in using the medicine with citizens and patients. That's where you can play an active role.
And that brings us back to one of the dilemmas that we as an industry have. So we have a lot of information, we have a lot of insight, we have a lot of knowledge, but we only have very limited possibilities to share them. And that might be for good reasons, but there is still a dilemma that in a situation where all hands need to be on deck to inform the public, there should perhaps be a role also for the industry. And we have, perhaps we should think more about how we use our opportunities when it comes to providing disease awareness information, health information, that it should be then aimed very squarely at what we're mentioning now, talking about now, how do we contribute in raising the level of health literacy and self-care literacy as well, or self-care, in the population.
I think we all have our different agendas, right? So industry, you can do something, but the professionals can do something. We as consumers can do something. So where do we meet in the middle? And within working in that sphere, we also know that there are some legal boundaries that we need to stick to. And the consumer, you would ask, okay, why is medicine available in one country but not another? Because we live in a global world, so those who have a certain disease, they will seek, those who are very well informed, very health literate, they will join patient forums, they will know about the newest developments, and this is where partnerships can be formed with patient groups, so that we work in a collaborative effort, learning from their day-to-day experiences. And professionals may not always be the best informant in that case. They see the patient a few minutes in a consultation in their building, on their premises. They don't know about the daily life. So we need to make sure that we all tap into the life world of the patients, and that can be done in different ways within the legal boundaries that we have.
We have talked about the importance of collaboration and cooperation when it comes to health literacy. This is not only a personal responsibility, nor is it a system responsibility. Someone has to be in charge, though. Who would that be?
So the easy question is to say that we're all in charge of health literacy, but some are in a position where they can create supporting conditions, conducive environments, and I believe the industry can do much more, not only for the consumers but also internally. I did a study on the corporate health literacy and how corporates work with health literacy, usually at the workplace, and it was like a tick the box exercise. Fruit baskets, fitness rooms, mental health programs. But for me, it's much more than that. It's about really looking at health from a holistic point of view, making sure that we can talk about mental health in a much more open way, making sure that everyone has the opportunity to do exercise, not only those working in buildings, but also the truck drivers, those at the factories, that there are personal aspects that can be taken into account. It can be maybe supporting people where they are in their life phase, new parents, for example, to make sure that they have time off with their children. If there are any additional skills that need to be taught, because health is part of lifelong learning. So health literacy takes place at many levels, so to speak, and the corporate world can implement that because you are engaging so many employees.
So Kristine, where can people seek information on becoming more health literate, if you will?
So health literacy is built on the way we use information to take decisions. It's also about health education. So people can inform themselves about health topics. That can be on internet, it can be through the media, it can be based on campaign from authorities, it can be the old school leaflet. And there are different channels where you can find information that is relevant for you. It can be about joining patient forums. So I think the ways we see now, there are so many different approaches to getting information on health. What is important is to judge whether it's relevant for yourself and how it links to your challenge, the health challenge that you're facing. It can go and what to do. So can you book an appointment with your general practitioner? Could you dive into more about a certain topic? If you want to learn more, can you get access to the kind of information that you need in a timely manner? That's where the challenges are. Do you know whom to contact if you want to know more? So a lot is out there on the internet, but it's not only about downloading the first 10 hits on Google. It's also about asserting them, reviewing them, and knowing the trustworthiness of sources. And that comes in the way we talk about health in daily situations, in the lunch break, with your parents, with your family, with your relative, what you read, what kind of news you seek. And there we might need to be a bit more critical in the way that we judge the sources of information that we have.
So thank you, Kristine, for sharing your thoughts and insights with us here on Voices of Pharma. And thank you for listening in, and see you next time.